All right, guys, Kyle Hartfield. I talk TMS. Today we're in beautiful, sunny Southern California. Dr. LaFrenierre, double board certified psychiatry and addiction medicine. In the space of TMS, the importance to it, man, I can't speak highly enough about it. This technology, when it comes to addiction, is life-changing. It changed my life. It is why I am sober today. She runs the BrainsWay machine, which when I've seen and when I'm talking to all you guys online in the comments, a lot of you guys are getting in this chair, afraid to get in this chair. And that's what's important for me to do this with her.
Nice to meet you.
Nice to meet you.
We're here for your mapping today. Are you ready?
Yes, ma'am.
All right, we're going to get you into your cap. These are our BrainsWay caps. They're brand new. Go ahead and lean back for me and just relax.
Lean back, okay.
Yeah, just nice and relaxed.
I came forward to...
I know, I'm going to just put my stuff here.
Just try and help out.
Everyone does. They start ducking and weaving.
While you're doing this, I have to say that out of the 5 years I've known about TMS4 since I did my very first session, this chair has always been my nightmare. I have to say it.
What do you think the fear is?
The intimidation factor. This chair to me has always been extremely intimidating. So before I did TMS, it was ECT to me, right? Mm-hmm. And so when I saw this one, I was like, that's ECT, there's no way, right? Now I've seen many of people go through this treatment. And so I am glad after meeting you and sitting and talking with you, I do feel comfortable, completely comfortable doing this.
Good.
I don't know if that's you or just my knowledge of TMS at this point, but
a little of both.
You definitely play a part.
Good. A little of both. You know, BrainsWay is a deep TMS system, and so it does feel and sound intimidating. We do get better results because we're targeting neural networks. We're not just targeting one single spot like a figure 8 coil.
Okay.
So BrainsWay coil is actually in this helmet, but it's surrounded by cloth. So it's very soft on the inside, very pillow-esque. And the helmet itself is going to come down and it's going to hug your skull. It's going to be very comfortable. BrainsWay is also not as painful as people think because of that cloth covering. We're not losing energy each pulse. So it's not going to feel as sharp as figure 8 coils.
Okay. Huh. So I've been in multiple manufacturers at this point, and I'm interested to see what this feels like.
Yeah, you're going to love it. Are you ready?
I'm ready.
Okay. Go ahead and stare straight ahead at that painting for me. Oh, we need an extra large.
I told you.
I'm just kidding. No, you're good. You've got a TMS-friendly head is what I say. How are you doing?
I'm doing great.
All right, you look good.
I'm excited.
All right, so we're gonna do the mapping now, okay? This red strip is your motor strip. That's what guides your movement for your body.
Okay.
This white area is where we're targeting, okay? Dorsolateral prefrontal cortex. Right when those two areas cross, you see it says fingers and thumb. I'm gonna be sending energy to try to find that spot to make your thumb move. So left side of your brain to make your right thumb move. So our brain crosses wires. Okay. So that's going to tell me that's the amount of energy to stimulate and wake up this part of your brain that we're targeting. I'm going to have you put your arm on this pillow like you're getting a blood draw. Perfect. There you go. I'm going to have you uncross your legs for me. So for the mapping, I'm going to be bringing the coil down on your head. You're going to be feeling some pulses and taps. Your eye might blink. It's very normal. Okay. Stay nice and relaxed. So I'm going to be sending energy trying to find that spot while watching your thumb move. I might tell you to make a fist. I do the activated motor threshold, so I might tell you make a fist, relax as we fine tune it and find that spot. Once we find the spot, the coil is going to come all the way down nice and snug on your head. You're going to feel it pulsing on both sides of your head. 2 seconds on, 10 seconds off. And we'll do that back and forth for about 10 minutes. Okay. All right? Yep. I just like to explain the mapping is just very different than the actual treatment. All right, you ready?
I'm ready.
Okay, here we go. I have to put a little bit of pressure, so try not to move your head.
It's a big head, I told you.
Hey, you just gotta stay still for me.
So the cap is one size fits all?
We have different sizes. But this is we do have extra large, we hardly ever need them. All right, you ready? Here we go. Do you know what your motor threshold is typically? No. You don't know all the times?
All the times I've been mapped, I've never asked that question, I swear.
All right, open your hand.
I'm not a detail guy.
All right, I'm gonna give your brain a little break.
My wife will tell you that one.
All right, cool, that's where we're gonna stop.
I've never had it on both sides before. That part is interesting.
The bilateral?
But I understand what you're saying by the figure 8 is sharper,
Yeah.
right?
Yep.
I understand that now.
Yeah. And because most of them are encased in plastic, all of them are encased in plastic, you're going to get a disbursement of energy as soon as it hits your scalp. And that does feel very sharp and rubber band-like. This isn't going to feel like that.
No, it's more, so I always use this analogy, right? It's just a light tapping. But this is more, it's just this. It's more of a thumb,
Yeah.
right? It's a larger,
Yeah.
but it's not painful in any way.
It won't be. And we're going to turn it down too. And your threshold's slightly lower than average, so you're going to do great. What protocol do you want to try? Theta burst, PTSD?
Give it to me.
What's your main struggle?
Life.
PTSD. Okay. This one's the more calming one.
Okay.
We can do both because they both sound different. Sorry, just want to get your beard here. Here you go. They both sound and feel different, so you can feel them both.
Okay.
Turn it down. So this is our PTSD one. So this one's a lower frequency. It's going to be more calming. Have you put your earplugs in? You can move your cap. I'll fix it.
How you feeling, Cal?
I feel great. I mean, when we were driving here, we talked about, obviously the fear of this chair. I've had it forever, but I even said when we were coming down, I wasn't afraid to do this today at all. I've never put earplugs in to do this, to do TMS. I've never put a mouth guard in to do TMS. And right now, I have no concerns about my safety, about any side effects or anything that could come from this. I shared with you, ECT was always my mindset. With 350 sessions under my belt, and I know how common this chair is, none of these things are concerns to me.
A reason why we use the mouth guards, you're not going to break your teeth or anything, but because we do that bilateral stimulation, it's very close to your temporalis muscle that controls jaw movement. So for some people, you do get a little bit of energy transfer and a little bit of twitching, and the mouth guard's more for comfort.
Okay.
So I do recommend people try it, but again, I like to but I do tell people we're not going to break teeth or anything. That's part of my spiel. Like you're not going to, it's not ECT, right?
And it's a new mouth guard. It's not
brand
like they're
new.
giving you
I
someone
can't even open it.
Previously used. So I imagine like the football, like the football players have to put the full mouth guard in is what I imagined. But no, this is
just a little bite
obviously not easy to talk with, but for you guys,
the full experience.
I do this for you.
All right, you ready? How's that feeling?
I feel great. You don't even know it's there, honestly.
All right, I'm going to give you a countdown. We usually do a test. So you're going to feel it for 2 seconds, and I'm going to pause it, check in with you. If we have to turn it down, we can, but we're already starting at 70%. I think you're going to do just fine.
Let's get it.
All right, we're going to start in 3, 2, 1.
Huh.
What do you think?
I get it.
What do you think?
It's nothing.
Yeah, do you want to restart it?
Restart what?
Well, I just gave you the test. Do you want to do like
Do
some
whatever
cycles?
you're gonna
All right. All right, you ready? 3, 2, 1.
And that's theta burst?
This is our PTSD one for anxiety.
Okay.
If I can pause it when you're ready, we can just switch over to theta burst. So this is our PTSD protocol where we'll start people on this one for anxiety, for sleep, for triggers, nightmares.
Yeah.
Sometimes, as we peel back those layers, you can get a little bit of uprising of symptoms that maybe you've been masking. But I tell people, push through that because we really are activating that circuitry involved in PTSD and trimming those threads, trimming those trigger points. So as people go through the PTSD course, we actually have them focus on trauma triggers, events, memories to activate that circuitry. And then when you activate that circuitry, kind of like when I'm mapping you, right? I had you do that to activate and draw that energy in. We have you activate your thoughts around trauma to help draw the stimulation in and trim those threads for better results.
It's different than any TMS I've done because it is coming on both sides. It's not painful in any way.
It's hard to describe. It is just a light tapping, but it's on both sides, which does tense my jaw, which, I mean, is obviously expected. Do you have people that close their eyes when it's going?
We don't want you relaxed. So that's the thing that a lot of TMS clinics will do, is they'll have TVs and aromatherapy and laser shows, but really...
Laser shows?
You know, light, there's all kinds of weird
Jeez.
stuff. There's some TMS rooms are very psychedelic-y, which we don't actually want. We don't want you in alpha when you're in TMS. We want you activated.
Right.
Right? So if we're doing depression, I want you focusing on your guilt, your shame, your sadness, what's keeping you in bed every morning. Again, to highlight those circuits so that the TMS is drawn into those circuits to regulate them. If you're in alpha and you're relaxed, the TMS will still do its job, but let's just optimize its efficacy. I don't want you in alpha. We're going to lose our targeting.
The preconceived notion that I've always had about this is I was gonna, I was gonna go into a convulsion, basically.
You'll see some scary stuff online, but again, the way we do things here, I know what I'm doing, right?
Yeah.
You're getting mapped by a psychiatrist. We do that activated threshold as well, so we can really fine-tune the optimal activation for your brain, right?
Right.
I'm not stopping as soon as your hand's twitching, like, oh, great, I got it. No. We
Right.
want that really subtle movement dialed in, because that's what's going to be more effective and more comfortable.
Which makes sense, because a lot of people, you get that one, and you even read about people that don't even get the movement, and they're still going right at that spot. I had to stop before when it goes. I'm like, hold on. Let me pause my thought real fast. I want to feel the theta burst.
All right. I'm just going to leave you strapped in if that's okay.
Yeah, you're fine.
Do you want to just do a 3-minute?
Sure.
So this is the one that I do for cognitive restoration, is a theta burst for 3 minutes.
You do this on yourself.
Well, I mean,
or you have somebody come in and do it,
I have them put it on me, but yeah. I've got 3 machines, of course. So I like the 3 minute because I can't sit longer than that. But yeah, I do 70 to 80% of my motor threshold for optimal like cognitive restoration.
And how long have you been doing that?
For a year.
And
I do it like maybe once or twice a week, nothing crazy.
Okay.
Yeah.
But see, to me, like that says so much, not only about you, but about your clinic and what you do here. Mm-hmm. If you're not in that chair and you're not experiencing these things, like who are you to tell me what I should do or what's going to benefit me? Obviously, you're a doctor, you've studied, you've got your degrees, right? You got your plaques on the wall. Great. Have you done this? You're saying yes.
Yes.
And I respect that so much, it's not even funny.
I look forward to it. It's like a craving.
People ask me all the time, Kyle, you still do TMS? I'm like, I was in the chair. I got out of the chair to come into this meeting to meet with you because I know that I'm better with TMS.
Yeah.
Kyle, why do you still do TMS? Because I'm better with it.
Why wouldn't you do TMS?
Why wouldn't, and unfortunately, I own those chairs.
Yeah.
Why wouldn't I get in one?
Exactly. All right, you ready to feel the theta
Let's
burst?
get it, yeah.
Okay. I'm gonna do another countdown.
Excited.
I'm gonna do another countdown for you, all right?
Okay.
It's gonna feel a little bit different. 3, 2, 1. You got that movement a little bit with this one, a little bit more with that one. But again, you're not gonna break your teeth, right, if you don't have that mouth guard in. You got the mouth movement.
Again, it's. I know that this is healing.
Yeah.
And it's firing. Yeah, my jaw's clenching, but no, like
It's not
it's
a
not
bad clinch.
painful.
Yeah, it's not a bad clinch. It's just a little bit of pressure.
Yeah. It's really nothing.
What are you thinking about? Like in the zone.
Life. And how crazy life is and
That's bringing stuff up.
how wild my life has been.
But did you notice how it's flipping that switch in your circuits, right? From podcaster performance mode to you dialed in right there.
Yeah, but no, like, so my life has been so crazy. And to be here doing this, with you, it's a blessing. It's truly a blessing.
Yeah.
And I do believe that I'm very blessed and that he's put me here to do things like this, to share with people, because, I mean, if you saw me before, there's people that don't believe that I do this for the greater good.
Yeah.
There's people that believe I do this because I make money on it and that I'm performing.
Yeah.
I don't think anybody's gonna do this as a performance, number one. But no, like, there's nothing I have to perform. I'm so blessed, it's not even funny.
Yeah.
And that's what I'm thinking of. Just how my life, everything I've done in my life got me here. It is so crazy. And it's beautiful.
You're done. That was it.
That was 3 minutes
That
too.
was 3 minutes. Yeah. All right. Do you want me to get you out?
Please. Honestly, in so many ways, I have felt bad. And I didn't understand, number one, why people bought this chair, with it being so intimidating and loud and painful. And you hear the jackhammer and all these negative things about this device. I've heard it so many times. I've thought it. I've totally thought it. But once you do it, I'm thankful that BrainsWay is one of the most popular chairs. And most people, especially in the rural communities, I've noticed the rural communities typically have BrainsWay. With the 3-minute protocol, it makes total sense. You're in, you're out.
Yeah.
And there's no headache. I'm about to get out. I'm about to drive an hour to go home. And there's nothing that I cannot accomplish today after doing that. Get yourself in a TMS chair, because I promise you, life is better.
You gonna sleep so good tonight?
And that's something that I could not do most of my life, was sleep. Do you mind if I call you Dr. Stephanie?
No, that's
Because
fine.
that's more comfortable
Yeah.
for me. I want to thank you. I want to thank you not only for this space, for healing people, helping people, and just for who you are. Your demeanor, your energy instantly makes me more comfortable to get into the machine that I've been afraid of for 5 years, and not only do it, but feel better. Day one, that's got to say a lot. I mean, I can't imagine how you get to go home and feel, you know?
I love what I do. I love helping people. I think we have a great system, a great clinic.
Yeah.
This is my passion, you know, all my training and everything has led up to this moment of being able to treat patients and treat them right and get them better. So thank you for joining me.
No, I'm glad we were able to come and do this. Everyone out there, Resiliency, man, come check them out. The beautiful office, again, wonderful location, easy to get to, and they take insurance. Covered by insurance.
Accessibility
Everybody
matters.
except Kaiser,
Yeah.
unfortunately, but
we put a letter out. We'll see.
yeah, I know that battle, right? So no, but even more so, like everybody besides them, that's amazing. I know so many people that don't take insurance in the first place.
Right.
So congratulations and thank you for doing
You're very
that.
welcome.